Okay, we are going to go ahead and get started this evening. Good evening, everybody. My name is Pat Kane, Public Programs Manager within the Museum and Education Department at the Champaign County Forest Preserve District. And I want to thank you all so much for joining us this evening as we continue our special speaker series, where in just a few short moments, I will bring on Lynne Curry, our presenter for this evening, to present the program titled Kids and Germs, Child Health Reform in the 20th Century. Before we get into that, I just wanted to go over a few items, let you know about some things coming up at the museum, as well as go over a few housekeeping things. So first, let us know where you are watching from this evening. Always like to see where folks are tuning in from. Coming to you live from my home here in Champaign. Jim is letting us know that he's tuning in from Appleton, Wisconsin. So thank you so much, Jim, for tuning in all the way from Wisconsin. So do us a favor, right where you're watching from, down in the comments section below. Tonight, we are also joined on screen by Janie. Janie will be assisting us tonight with American Sign Language interpretation. We greatly appreciate Janie being here for that. If you don't know much about the Museum of the Grand Prairie and Champaign County Forest Preserve District, Museum of the Grand Prairie opened originally in 1968 as the Early American Museum, and our current mission is to collect, preserve, and interpret the cultural and natural history of Champaign County for all generations. We're part of the Champaign County Forest Preserve District, which is a collection of 7 forest preserves here in Champaign County in East Central Illinois, 2 educational facilities, which includes our museum, as well as the Homer Lake Interpretive Center at Homer Lake Forest Preserve, Lake of the Woods Golf Course, Kickapoo Rail Trail, Multipurpose Trail, and so much more here in Champaign County, East Central Illinois. In fulfillment of our district's mission to protect Champaign County's natural and cultural resources and inspire people to care for, enjoy, and explore their natural world, the Champaign County Forest Preserve District recognizes its responsibility to acknowledge those Native peoples who came before us on this land. We currently work to preserve and tell the story of the lands of the Peoria, Kaskaskia, Waya, Miami, Kickapoo, and Potawatomi nations. Native Americans shaped the landscape that the Forest Preserve District sits within, and we must recognize that the forest preserves occupy the ancestral, traditional, and contemporary lands of the peoples previously mentioned. They were the first stewards of this land, and it's necessary for us to acknowledge these Native nations, to work with them, and to continue to steward the land and educate the public with honor and respect. CCFPD will work to be inclusive of all differences and keep Native peoples and their history at the core of our efforts. This program is one of many programs in a special speaker series of virtual programs. The series began earlier this summer and has included virtual programs over the last several months, with more programs still to come this year. All programs are tied to themes and elements present in our newest special exhibit titled A History of Healing, Infectious Diseases and Community Responses to Defeat Them. The exhibit opened in May of this year, and the exhibit focuses on the local and worldwide impact of such diseases as the 1918 flu, smallpox, malaria, tuberculosis, polio, typhoid, cholera, HIV, AIDS, and COVID-19. In addition to examining the impact disease has had on our health and well-being, the exhibit highlights particular instances in the past as well as the present where local citizens came together during previous epidemics and pandemics for the betterment of their communities. We encourage all who are local to come and visit this special exhibit at our museum. Our current fall hours have the museum open every day from 1 to 5 p.m. And as always, admission to our museum is free. Also, just wanted to promote a few other programs coming up in the very near future at the Museum of the Grand Prairie. On Saturday, November 5th, from 1 to 4 p.m. in person at the museum, we will host our annual Explore Archaeology Open House in collaboration with the Illinois State Archaeological Survey and the East Central Illinois Archaeological Society. There will be numerous hands-on activities, demonstrations, displays, Also a presentation on flint napping as well. So come out and join us on Saturday, November 5th from 1 to 4 p.m. for that Explore Archaeology open house. The following day, on Sunday, November 6th, Dr. Glenna Schroeder-Lane, manuscripts librarian for the non-Lincoln manuscripts at the Abraham Lincoln Presidential Library in Springfield, Illinois, as well as the author of Lincoln in Medicine, will present a program of the same name. This program will occur as a hybrid program, so it will be live in person at 2 p.m. on Sunday, November 6th at the museum, and we will also stream the program simultaneously online, just like tonight's program, on our Facebook and YouTube pages. On Sunday, November 13th, Mike Mosley, curator of the Pearson Museum in Springfield, Illinois, will present the program titled Medicine from the Past, a sampling of medicine from the Civil War era and Springfield area. And again, that program will be in a hybrid format, live in person at the museum, as well as streamed online. For updates and more info on all programs within this series, as well as what's happening throughout the museum, the Grand Prairie and Champaign County Forest Preserve District, we encourage you to find us on social media or visit museumofthegrandprairie.org or ccfpd.org. Should you have any questions or comments tonight, again, put those down in the comment section. I'll be moderating those throughout the evening. And then at the end of the program, we'll have a short Q&A as well. Lastly, a special speaker series is sponsored in part by our friends at Illinois Humanities. I'd like to thank Illinois Humanities for supporting this virtual speaker series. We really enjoy working with such great organizations like Illinois Humanities and are very happy to work together to provide these virtual opportunities for our audience. Okay, without further ado, enough of me talking this evening. You all didn't come here to hear me talk all night. I'm going to bring on Lynne.
Hi, everybody.
Hi, Lynne. How you doing tonight?
Doing well.
Lynne, thank you so much for being here. Thank you for presenting with us this evening. So I'm going to introduce Lynne, and then I will turn the show over to her. Lynne Curry holds a PhD in history from the University of Illinois at Urbana-Champaign and is Professor Emerita of History at Eastern Illinois University. She is the author of several works examining the intersections of American law, medicine, and the history of childhood, which include the DeShaney case, I hope I'm pronouncing that correctly, child abuse, family privacy, and the dilemma of state intervention, which came out in 2007, and religion, law, and the medical neglect of children in the United States from 1870 to 2000, which came out in 2019. So without further ado, let's give a warm virtual welcome to Lynne Curry.
Thank you. Thank you very much, Pat. And thank you for inviting me to be part of this series. It is giving me the opportunity to really go back and look at material that I researched for my PhD dissertation. And it was also the subject of my first book. And so that was in the 1990s. And so it had been a while since I had looked at this particular material. At that time, of course, I had no way of knowing that at some point in the future, I was actually going to be experiencing a global historical health event. And so it has given me a lot of reason to kind of go back and look at this material again and think about some of the issues. So having this particular opportunity has really been fantastic. So hopefully I can give us an overview, and then I would just love to entertain some questions. Before I put up my PowerPoint show, I want to just explain that the format I thought I would use tonight is I'm going to kind of start with a big picture, and then I'm going to kind of move us down tighter and tighter and tighter till we get to really some very local information. So here is my PowerPoint coming up. Let's see. Oh, here I am. And are you seeing that?
Yes, we are. Yep.
Okay. Like that?
Beautiful.
Okay, so here we go. I am really thinking about this big picture. And as probably many in the audience tonight know, that because you've been looking at either the exhibit at the Museum of the Grand Prairie or you've heard some of the other talks, in so many ways, the decline of infectious disease is the history of the 20th century United States. And I just have a little graphic there on the right that really, I think, very neatly and succinctly shows you what we mean. If you're talking about an average life expectancy at birth of 47 years in the year 1900 to 76 years in the year 2000, that's stunning, right? That's a stunning change over the course of the 20th century. Now, not all of that change can be attributed to the decline of infectious disease, obviously, but certainly a great deal of it can be. And when we're talking about infectious diseases, of course, we're talking about a range of possible illnesses. And just to clarify quickly, terms and what they mean. Endemic, an endemic disease is something that's always in the population. So historically, tuberculosis and malaria were both infectious diseases that were just always around. Epidemic is different, because an epidemic disease would tend to come in, hit a community, and then leave again. So there would be periodic waves of diseases like cholera and smallpox. And then, of course, we all learned the meaning of pandemic, like the 1918 influenza pandemic, which simply means that it's a contagious disease that has crossed continents. When we look at the decline of infectious disease and the subsequent correlated rise in life expectancy, so much of that change is precisely because infant and childhood mortality decreased so dramatically. And again, there on the left, I have a graphic that shows us very clearly when infant mortality is very commonly measured as the number of deaths of infants 1 year or younger per 1,000 live births. That's just a common metric that is used. In 1900, it's 165, and then in 2000, it's 7. So again, a very, very dramatic overall decline. I should point out that this is just a general number. It certainly, specific communities, specific regions are going to have really different experiences, but this is just sort of an overall measure. And when we're talking about deadly childhood diseases, many of these diseases were bacterial. So probably the largest single category is a very vague category that was referred to as cholera infantum. And more colloquially, it was often called summer complaint. And these terms, again, they're very broad terms that would have been used in the 18th century or the early part of the 19th century. And what they were really referring to was just this entire spectrum of bacteriologically caused diarrheal diseases in children. And that was probably, it's safe to say, the number one reason that children died of infectious diseases was because of these particular kinds of diseases. And they could be extremely frightening, because a perfectly healthy seeming baby could suddenly sicken and die over a very short period of time. And so it was a quite frightening phenomenon, and sadly, tragically, a rather common phenomenon. It was often called summer complaint because it was just something people noticed tended to be more prevalent in the summer months when it was warmer, right? So bacteria have more opportunity to grow and to spread. The second biggest general category are respiratory type diseases, bacterial pneumonia, for example, other kinds of respiratory ailments. And then I also put in there strep infections as well, which, may or may not be related to pneumonia or respiratory diseases, but this kind of infection was very common as well. Diphtheria was a major killer of children in the particularly in the 19th and into the early 20th century. Pertussis, also known as whooping cough, is another example. And then also tetanus. Tetanus would often strike an infant, for example, during the birthing process, if there was any kind of injury, particularly around the umbilical cord. And in the days before sterilization measures, that it would be very, very easy for an infant to pick up an infection and tragically succumb to tetanus. I listed diphtheria, pertussis, and tetanus in a row right there because probably many, many people out there will realize that that's the DPT shot that kids still get today, right? It's a triple shot that kids get in the early months that is particularly aimed at diphtheria, pertussis, and tetanus. There were also, of course, viral diseases that came and went and affected children, in significant numbers, such as measles, mumps, and rubella. Before the germ theory, and I'm going to talk about the germ theory in a minute, it was hard to do anything about infectious diseases once they were already spreading. And if you've seen the programming that the Museum of the Grand Prairie has been offering, you're probably already aware of this, various kinds of infectious diseases and what some of the measures were that communities would engage in to try to address a local outbreak. It was hard if you didn't really know precisely what the cause was. So people obviously know that these diseases are infectious. They know that they are contagious, but they don't know exactly what the precise mechanism is that is causing the contagion. How was it exactly that these diseases could spread from one person to another? There were endless numbers of theories about how that might be occurring, but without having precise knowledge, it was hard to know what to do. I have some indications here. Quarantine was the most common thing, right? All you could do was sort of quarantine people off if they were at risk of exposure to try to make sure that they're lessening contact, simply to try to control the contagion. Isolation in the most extreme form, people were forcibly removed from their homes and put in a separate house. Colloquially, they were called pest houses. The picture I have there in the center is actually in Sangamon County, a so-called, a pest house, which later would be called an infectious disease hospital. But people were literally forcibly, at times, removed and just made to stay there so that they didn't infect other people in the community. Smallpox vaccination is such an interesting story, and we really don't have time to go into it tonight, but it was a means of trying to control smallpox. It was around for a long time, certainly in the 1700s. It was around. No one was quite sure why it worked, but they knew it did work. And so it would often be something. There would be attempts to inoculate a population if smallpox was present. And then I sort of have engineering, right? Just trying to do something to engineer the environment, to try to control contagion. Once it becomes obvious, for example, that cholera was spread through shared water supplies, how can we ensure that water supplies will not be carriers of major epidemic diseases? So something like the building of the Chicago Sanitary and Ship Canal, which is the other photograph I have in the center there, was an attempt it was a major engineering marvel that was intended to do something about water supplies in the Chicago area. So all of these are things that are attempts to control contagious disease, very well-known attempts. But again, without knowing exactly what is causing these diseases, it was really hard for communities to be able to control contagion. There was probably, extremely importantly, there was always self-help, right? People are always going to do whatever they could do to help their own families or their own communities. There was no shortage of advice manuals. Some of them were written by doctors, some of them were written by other kinds of reformers. And there was just no end of this kind of literature. It was very, very popular, actually, especially in the early 1800s. Basically, just giving people various ideas. If there is a disease in your household, how can you help this person, right? How can you alleviate symptoms? How can you recognize symptoms of disease? And there were, of course, patent medicines, a completely unregulated market in the 19th century. Most of these were aimed at, trying to suppress symptoms. Many of them were, in fact, various forms of opiates or alcohol, which might make a person feel better temporarily, but obviously had little or no curative effect. I wanted to say, particularly mention the role of women in all of this, because I think in any traditional household, say in the 18th or the 19th century, it's really primarily women who take on this job, right? They're the healers of their household. They're the people who are going to be reading these advice manuals and tending the sick, and particularly when it comes to children, right? Looking after the health and well-being of small children. Well, here's what happens then in the later part of the 19th century. It's this revolution that's brought about by bacteriology, because in the 19th century, it becomes possible to become much more precise about what it is that's causing contagion, and that, in fact, it's bacteria in the environment. And it becomes possible to link specific bacteria that you can see under a microscope with specific diseases. So, diphtheria, which on the right there, that slide, is the bacterium that causes diphtheria, was one of the earliest of these. Kind of the earliest triumph was the realization that this really terrible, terrible disease that hit children so tragically, we could actually see what was causing it. I should say, just real quickly, that the ability to see viruses didn't come about until the 1930s. Viruses are much, much, much smaller than bacteria, and so you had to have an electron microscope to be able to see them. But a lot of what was learned from looking at bacteria and being able to identify bacteria was kind of just generalized to viral diseases as well, even though you couldn't actually see them until much later. So bacteriology really revolutionized children's medical care. Pediatrics was a new medical specialty in the late 19th century. It really arose in the mid to the late 19th century. So it was just kind of getting off its, getting off at the starting gate, really, at this period in the late 19th century. And when bacteriology comes along, because so many diseases of childhood were caused by, various bacteria and viruses, it gave a huge boost to pediatrics as a medical specialty, because then it became possible to say, we can actually, with a little bit more precision, start to identify some of these diseases. Now, there still weren't a lot of cures, so we're still primarily talking about prevention, really controlling contagion rather than curing diseases once children get them. But we can be more precise about how we go about trying to control them. Diphtheria antitoxin is a big exception, because diphtheria antitoxin actually made it possible to stop the progress of diphtheria in its tracks. And so if you could get antitoxin to an infected child soon enough, quickly enough, you could actually stop the progression of the disease. And diphtheria antitoxin started being used in the United States It really got underway in the 1890s. And it was just, huge. It was a big moment in the medical history of childhood, simply the ability to stop a bacterial disease after it had already taken root in a child's body. Primarily, sanitation and hygiene remained the primary way that people had to keep infants and children healthy. And so most of the emphasis was still on cutting down on the transmission of bacterial diseases through sanitation and hygiene. And so all of that informed what was this incredible blossoming of infant and child health campaigns in the late 19th and the early 20th century. These were very, very broad-based. They took place everywhere. Everybody got on board with infant and child health campaigns. What's really notable about them to me is how comprehensive they were in their approach. They were looking at everything, really all aspects of a child's life, from feeding to how they were sleeping, to how much fresh air they were getting, to the kind of milk they were drinking. And I mean, these were just remarkably comprehensive campaigns. There was a lot of private and public cooperation. The public health infrastructure was pretty, minimal in the late 19th century and into the 20th century. And so there's not a lot, there's almost nothing at the national level. There's not a lot at the state level. So a lot of these tended to be really very local efforts. They were conducted in both urban and rural areas. Lots and lots of people got on board with these. And often infant and child health organizations were formed specifically at this time, right? So something like the Infant Welfare Society of Chicago or the American Association for the Study and Prevention of Infant Mortality. These were new organizations that came about at this time. But many times these infant and child health campaigns were kind of grafted onto existing organizations. So in the late 19th century, women's civic clubs were huge. And there were women's organizations both in cities and in rural areas, in the North and in the South, in the East and the West. These were organizations that already existed. And many of these organizations took on these infant and child health campaigns in the late 19th and early 20th century. So that meant that women's participation was extremely active in these infant and child health campaigns. And in many cases, women were the leaders of these campaigns as well. And it kind of made sense to people, right? If women were traditionally seen as responsible for overseeing the health of children in the household, kind of taking that out in public and doing what women always did anyway in their own homes and doing it out on a public stage, that just made a lot of sense to people. And so there was just this space for women to devote their energies to these kinds of campaigns. And Illinois was no exception. There were very, very, very active movements going on. Some of these were taking place in Chicago. I mentioned the Infant Welfare Society of Chicago a moment ago. That was founded in 1911. Very soon after that, there were a number of kind of offshoots. So, for example, in a lot of the suburbs of Chicago, I think Oak Park formed their Infant Welfare Society the following year, 1912. And so these kinds of things were very, very common. Women's clubs, as I mentioned, the Women's City Club of Chicago would be a really good example. This was an organization that already existed, and then they took on many of these infant and child health activities. Settlement houses, right? So something like Hull House in Chicago took on infant and child welfare activities as well. And in Chicago, many of the kind of the population that they were really addressing was immigrant communities. So when people started going out and when they started looking around at various immigrant neighborhoods in Chicago, it was really, really shocking, the degree of infant mortality in these many of these communities. And so they kind of became the focus for a lot of these activities in Chicago. In the middle slide there, or the middle photo in the slide there, you'll see children drinking milk. And this was one of the things that the Infant Welfare Society did. In fact, it was one of the primary things they did. They pushed for children to have pasteurized milk in sterilized bottles. And they would give these out for free at infant welfare stations for mothers to come and be able to pick up for their children. On the right there, you can see babies being bathed. That's actually at Hull House, the settlement house in Chicago. There's kind of like this mass bathing thing going on, keeping children clean. Down here in the center, you can see these interesting looking hammocks, right? This was, I thought, one of the most interesting things. Fresh air was thought to be extremely important, right? When we get the idea that bacteria are floating around, right? We want to have fresh air, right? We want to be able to make sure that people are able to breathe fresh air. And so there would be these kind of either set up in a tent. This looks like it's a little bit more of a structured building, but they would have kids come in these hammocks often who were ill, and they would have their parents, primarily their mothers, come in and place the babies in these hammocks. And the idea was they were exposing them to this fresh air. And so it was thought to be sort of a therapeutic measure for these kids. Rightly or wrongly, I think a lot of these reformers thought, well, these children are living in kind of, tenement houses where there's a lot of overcrowding and there's a lot of people there. And if we can simply have an ill baby, a baby who might be experiencing some respiratory distress, if we can bring them out and put them in the fresh air in a hammock, right, that in fact might help them. So this was kind of a big project that people did in Chicago. On the right here, the lower right, I have a photograph of an infant welfare activities in the African American community. And because so much of America was racially segregated, that was just a reality of the late 19th and the early 20th century. And so infant and child health campaigns tended to be very racially segregated as well. So African American club women, in exactly the same way, in parallel with white club women, would take on these many of these infant and child health campaigns as well within the African American community. So Chicago was certainly not the only focus of these activities. The kind of the downstate region saw so many of these activities. Again, the Illinois State Department of Public Health was not really very well developed at this time. It had been the Illinois State Board of Health, and that was founded in the 1870s, and it didn't become the State Department of Public Health until 1917. So it's really still in kind of a growth phase here. And so there's not that much going on from the state health department. So a lot of these activities were, again, rural women's clubs. They're carrying out these activities. Many people in the audience might be familiar with home bureaus. Home bureaus were kind of the gendered extension of the farm bureaus. And just like the farm bureaus were intended to take kind of new knowledge about farming, new techniques, technological advances to improve farming, home bureaus were intended to be the parallel of that for women. So the idea would be, here are the latest ideas about infant and childcare, about how to bathe a baby, about making sure that flies aren't buzzing around a baby, making sure that your family is not, pulling water from a well that is too close to the outhouse. Maybe ensuring that, there's some sort of access to pasteurized milk, for example. All these kinds of things would have been activities that women would have participated in through the home bureaus. In the center, I have this picture of these, the kids and dogs. And the reason I have this picture there is One of the most active home bureau leaders in this regard was a woman named Claire O'Brien, who was with the McLean County Home Bureau. She was incredibly active in a lot of these activities, and she herself is not in this picture, but she took this picture. So as well as leading so many of these home bureau activities, she was also a photographer. And so it's kind of wonderful because we actually have images that we might not otherwise have had of kids, of rural kids in the early 20th century without a Claire O'Brien photograph. Below that, you can see this exhibit, and this is very, very common. Exhibits like this would be both in rural and urban areas, but these would be traveling exhibits that would go along. Maybe they would be at a local county fair, or maybe they would be at a church or some other kind of venue. And these would be exhibits that were intended to kind of interest people in the idea of that infant mortality was a problem, and that there would be ways that it could be prevented. Notice there on the sign, it said these babies died of preventable causes. So again, the idea is we know that these diseases are caused by bacteria. And so through controlling bacteria in the environment, this is how we can prevent them. On the upper right here, I have a kind of this mass examination that's going on here. You can see it looks like all kinds of people are kind of looking at kids and doing medical exams on them. I'm gonna talk a little bit more about that. Some of these were, just sort of opportunities for mothers to come in and have their children looked over by health professionals. So those would be activities as well. And then down in the lower corner here, I have an African American women's club, again from McLean County, which was a very, very active women's club. And they also participated in many of these infant and child health activities in the central part of the state. Early movies, some of these early health films, the vast majority of them don't exist anymore, right? They just, they decayed and fell apart and we can't see them anymore. But we know they exist because we have references to them or we have the scripts themselves. And so movies were kind of an exciting way to go around and extend this kind of interest and knowledge in infant and child hygiene, because movies themselves were exciting, right? Who didn't want to go see a movie in 1915? It was interesting to go see one. And then if it was also going to have this public health message, then that was even better. And then the press, the rural press was so active in the early part of the 20th century. Magazines like The Farmer's Wife or Farm and Fireside, Wallace's Farmer, they would always include sections on child hygiene, child care, knowing when it would be time to, take a child to a doctor, that their symptoms had progressed enough that you really needed to get medical help. This kind of information was really very, very ubiquitous in the rural press. So there were really all kinds of ways that rural women participated in these activities. One of the strangest of all were what were called better baby contests. And these are just to our sensibilities today, really, really strange. And so I wanted to kind of just set these apart and talk about them separately. It's really hard for us, I think, to realize until you start looking into this just how common these were. Everybody held these better baby contests. They were held at department stores. They were held, the Illinois State Fair had them, county fairs had them. They actually began in Iowa by Iowa club women, and then the idea kind of spread just everywhere, north, south, east, and west. All kinds of organizations held these, church groups held these. I've seen better baby contests sponsored by the NAACP, right? They're just all kinds of organizations. It's really interesting. Would have these. Now, what's going on in these better baby contests? I mean, it seems really odd, right? So are they really judging children? Well, yes and no, actually. The image that I have on the right here is from Illinois Health News. This was the brand new Illinois Department of Public Health put this out. This was a a magazine, and it was intended to be for the public, right? It was to get out information to the public. And in a really quite early issue here, you can see they're promoting on their cover the idea of a Better Baby contest at a county fair. And you'll notice what it says is a new dignity for the baby. At last, the young human receives consideration. And you can see there's a prize cat and a prize rabbit and a prize dog and a prize chicken and then a prize baby. So we would look at that and say, oh my gosh, that's really awful. Are you really reducing these children to the idea of of livestock? It just seems horrendous. Well, I think their intention, rightly or wrongly, what was actually to kind of flip that around, because judging livestock came first, right? That was something that would take place at fairs. That was a long rural tradition, right? In many places in the world, right? An agricultural fair is kind of a common thing. And so rural people were pretty used to having their livestock or their vegetables or their flowers judged. And so what infant welfare campaigns did is they kind of just tried to graft on to that and to say, you know what, we could also have these judging for babies and look and see if we can pick out who the healthiest babies actually were. Now, again, what's really going on at these conferences isn't as startling, I think, as we might think. And it's hard to generalize because they were so common, and it's really hard to say in any one place at any one time what people were thinking when they did this. But in my own research, what I really see a lot of is it's not as strange as you might think. In on the left here, this is an example of a scorecard from a Better Baby contest. And you'll notice they're taking measurements of, for example, the child's height and weight and the circumference of the head. And down below, you can see there's something called the table of standards. Well, I think we would recognize this. It's basically a well baby checkup, right? We still do that. People bring in an infant at periodic points, right? And the baby gets weighed and measured. They measure their head circumference, right? It's really just a well baby checkup. And what's going on in these contests is they're really kind of introducing the idea of periodically weighing and measuring a baby to monitor to make sure that they are growing and developing properly. What we have to realize is that, by and large, people didn't take their children to doctors unless their children were sick. So what that meant was that by the time a doctor was actually called into a case, a disease might be very, very far advanced, way too far advanced for anybody to do anything about it, tragically. And so there was a real push in these infant and child health campaigns, to get mothers comfortable with the idea of pediatricians, right? You should just go and visit a pediatrician, bring your child in, and also with the idea that monitoring a child's growth is in fact one way of seeing if they are thriving, if they're developing properly. If they're failing to grow and failing to gain weight, that is an indication perhaps that there is a problem that needs to be looked into further. The table of standards refers to what was really, again, new in the early 20th century, which was they were just starting to really get this idea in the field of pediatrics that by and large, kids should be hitting certain benchmarks at certain times. And so the idea that there's kind of a standard and then any one particular baby could fall within a normal range or could fall considerably below or above. Again, that's not anything that we're not familiar with at all. That you get that all the time. Babies who are checked by a pediatrician today, there will be something on their chart about relative to the standard. The baby weight fell in the 75th percentile or something like that. We're very familiar with that. So I just kind of put sort of a benign spin on all this because I generally think it's not as startling as it could be. Although there is this strange element, right, where we're saying, wait, if we're saying better, are we suggesting that, certain races are better than others, or certain ethnicities are better than others? And that's where things start to get really, really dicey, right? Because then it seems like, is there in fact a eugenic component in here? Yes, there probably was. And again, it's hard for me to characterize this because it was so ubiquitous. Did some of these baby contests have a less benign idea to them? Probably. That could have happened, right? I don't tend to characterize these in general that way, but I think that that element unquestionably could have been there. I would say when they're saying better baby, they don't mean that some babies are better than others in terms of, race or ethnicity or gender or anything else. I think they mean better as in the child is healthier, right? We would say well baby rather than better baby. A lot of this kind of campaigning that went on got a big boost in World War One, because people who were involved in these activities kind of doubled down and tripled down during World War One. There was a couple of things that really startled people. Like, for example, recruits, when draftees reported for service, it was found that a remarkably high percentage of young men, say aged 18, were unfit to serve, according to the military, because many of them had had serious diseases as children, and that rendered them unhealthy. They had never developed properly, or they had rickets as children, which caused them not to, for example, maybe their legs did not develop properly. And so there was kind of this strange sort of wake-up call. Wait a minute, there is in fact this huge impact out there of childhood diseases. I think it's also fair to say that many of the women that were running these campaigns, they were really worried that their work would be overshadowed by attention going to prosecuting the war effort, understandably, right? We're in a world war, we have to pay attention to that. And they were really worried about attention being drawn away. They were even worried about, for example, doctors and nurses being called to the front and they wouldn't be available for children's health care. And so in many cases, the people who were actively involved in these infant and child health campaigns, they kind of grafted their campaigns onto this idea of patriotism and nationalism. And again, there you can see on the left there, that's Illinois Health News again, right? Linking, right, a healthy baby very clearly to the idea of a healthier nation, right? The soldier and the worker are looking up to this healthy baby, right, as the strength and future of the nation. You can see, again, a very direct linkage between kind of patriotism and children's healthcare. There's a baby being weighed and a child being measured. And mothers and fathers of America, Uncle Sam asks, are your children up to this standard, right? So it's linking this very, very directly to this kind of new nationalism and patriotism. On the right, you have a poster from the U.S. Children's Bureau, the health of the child is the power of the nation. So on the one hand, this does it's a huge benefit. It's a huge boon to the infant and child health campaigns because it gives them so much energy, right? It brings a lot of attention to them. On the other hand, I think when you start linking these so directly to patriotism and nationalism, that's when this creepier, less benign eugenics side starts coming into it, right? When we start linking it very specifically to kind of goals of nationalism or patriotism, then we start sounding a little bit like, are we really talking about children's health, or are we really talking about, the national character, and are we talking about race here? And so things become a lot more questionable, I think, and some of the more disturbing aspects of things like better baby contests, I think they're much more prevalent during and after World War I. So what did all of this mean? Well, it's very, very hard to make any kind of one-on-one correlation between all of these activities and any one particular result, right? Who knows? But certainly we can see that the trends in the state of Illinois are very, very clear. If we are measuring infant mortality the same way, right? The deaths of children age 1 year or younger per 1,000, then we see a very, very distinct decline in the years when these infant and child health activities were kind of at their zenith, right? 1910, it's 149.9. By 1930, it's 55.8. Huge change, noticeable change. Can we attribute all of that to infant and child health campaigns? No. Can we attribute part of it to? Undoubtedly. Undoubtedly. I think we, in fairness, we have to say, yes, there is an effect that all of this is having. The trouble is it's kind of hard to measure in any kind of precise cause and effect way. But I think the numbers do tell the story there for the state of Illinois. I thought I'd end up with sort of some other legacies here, even if we can't say these particular activities, brought about this particular decline in infant mortality. There were some very long-lasting effects of this history. One is a very, very interesting piece of legislation, the Shepherd-Towner Act. This was the first federal child welfare measure. It was passed by Congress in 1921. It stayed in effect until 1929. And what this did, it was very interesting, is it basically brought the federal government into partnership with states to support these activities. So it wasn't healthcare. They weren't delivering healthcare. What they were doing is they were saying all of these kinds of activities that are designed to teach parents, particularly mothers, about infant hygiene and visiting doctors and milk pasteurization. All of these activities are going on anyway. What we're going to do is we're going to actually give money from the federal government to states to help them support these kinds of activities. And it was done in a model that has been used ever since, which is that Congress allotted some money and then states would have to match that amount of money. And then it was up to states to say what they were going to do with the money. And they did all kinds of interesting things. One of the most interesting states was Kentucky, where there were so many women who lived in extremely isolated areas. And Kentucky had not only very high rates of infant and child mortality, but also extremely high rates of maternal mortality as well. And so there was a particular kind of visiting nurse association. These were women that went around on horseback, and they were able to visit very, very remote areas. And this would be the kind of thing that states use Shepherd-Towner money for. Interestingly enough, Illinois was one of only 3 states that did not participate in the Shepherd-Towner Act. Illinois, Massachusetts, and Connecticut were the only 3 states that decided that they didn't want to participate in this. States were required to pass what was called enabling legislation, which meant the state legislature was saying, yeah, we're on board with this, give us our federal money. And Illinois opted out of it, interestingly enough. I think the bigger legacy is probably just awareness and education. These activities were so widespread and they were so vigorous that I don't think you could help but notice that there was, this kind of real interest and fervor for improving children's health. Importantly, I think it also provided an incredible amount of support for the growth of pediatric medicine. Pediatrics doesn't work as a specialty at all unless parents will bring their children to doctors, right? And so the idea of a well baby checkup, the idea of turning to a pediatrician, the idea of saying, yeah, I'm going to go in and have my child periodically weighed and measured, just even planting the thought out there among parents and particularly among mothers, I think, was a huge legacy of this. And so I think that we have to give a lot of credit to these infant and child health campaigns, which were largely run not by medical specialists, again, primarily by club women and various people who were organizing these kinds of activities, but they created this support for pediatric medicine. And then for me, just speaking, personally, I think one of the legacies, probably the biggest legacy we have, is just the idea that kids matter, right? That putting the idea across that, we don't have to accept high rates of infant and child mortality as just inevitable. That's just something that happens. Kids get sick and they die. That it's actually possible if we put our minds to it, if we care about this, if we pay attention, if we spread education, that we really can improve the health of children, that we really can, right, spare a lot of kids' lives by doing this. For me, whether or not we can correlate that with specific numbers when it comes to a decline in infant mortality, I think simply spreading the idea that kids matter and their health matters is a really, really significant historical legacy in itself. So that's where I'm going to end. If that's okay, I'll come back. And time for questions.
Yeah, thank you very much, Lynn. Appreciate the presentation. And as Lynn mentioned, if you have any questions, feel free to put those in the comment section. I have a few questions coming in already. I'll start off. Lynn, the Better Baby contest, that's something I'd never heard of, and that's
really weird, huh?
Unique and all of the different sort of things that are going into it, as you mentioned, or it's just a very, as you mentioned, weird and unique situation going on. But it's cool that it kind of helped pave the way for those well baby checks that are commonplace now. We've got one coming up with our 9-month check here in about a month or so. So do you have, I know you said that they were pretty prevalent, early on, but do you have any idea when these may have ceased, and or when the characterization of Better Baby contests went away, or anything like that?
Yeah, you don't really see them much anymore by about the 1940s, I would say. That kind of fell out of fashion. And I think there's probably a lot of reasons for that. One is that it was simply just much more common to have visits with a pediatrician. As that becomes much more normalized, then this idea that you would use this event like a Better Baby contest. A Better Baby contest would be the only time that a child would be weighed and measured, right? They weren't getting weighed and measured otherwise. But as that started to become more a normal part of just well baby care, there's not really a reason to have a special event for it, right? I think there's also a certain amount of backlash against the more overtly nationalistic kind of things that you start to see in the 1920s. Historians talk about, a lot of programs that were designed, not just infant and child health programs, but things like teaching English in immigrant communities, right? Or, a number of other kind of community social welfare programs for immigrant communities. They also take on this really kind of disturbing nationalist tendency also in the 1920s, right? So it's rather than, we're going to help immigrant communities as they adjust to life, right? It's more like, do it our way, do it the American way, right? And it takes on a different turn. And so you really do see a change in World War I. And I think by the time you get later to the 1930s and creepy things are taking place in Germany, and things are just getting really bad, right? By the 1940s, people are backing away from that kind of thing. There were always people, I should say, always people that were disturbed by this idea of calling it a contest. I saw plenty of women's organizations who really objected to the idea of even calling it a contest. The funny thing is, parents liked it, right? Parents love the idea of entering their child into a contest. They really like the idea of giving some sort of trophy. One of the most popular prizes was a photograph, because parents didn't routinely have their children photographed either. And so they loved the idea that their child would have a photograph of their child. It was a great prize, and parents flocked to these things. They were also popular with audiences. I mean, when Better Baby contests were held at a county or state fair, like hundreds of people came. And I've looked at the records of the Illinois State Fair, and yeah, they kept careful attendance records, and these things were like through the roof. Everybody loved them. Wow. And so they were really, really, really popular. And then I think there was sort of a pushback against them by about the 1930s or the 40s.
Thank you so much for that, Lynn. And it's just, I mean, babies still draw crowds today. So, I can see, and that sort of thing.
It's understandable, right? They were cute and people came to look at them.
Yeah. Shell has a couple questions. Shell says, did the speaker, in talking about home bureaus, say who funded the campaigns that the home bureaus promoted? And then
that's a great question. Yeah, this is really the beginning of the extension service, right? So mostly it's the state of Illinois through the University of Illinois, right? They're doing these household extensions and farm extensions. I mean, the Farm Bureau still exists, right? So it's publicly driven, but there's a huge degree of cooperation from like private groups. So a lot of the research is through the state, specifically through the state of Illinois, right? That is publicly, a lot of the stuff is going on at the University of Illinois or other universities, other state universities. It's going on in other states. They're doing it too, oftentimes through their land grant colleges. And so there is a heavy element of state support, which is they work in cooperation with counties or private organizations. And so a lot of it was about literally building the infrastructure for this.
And then still related to the bureaus, Shell has another question. Interested also to know if the bureaus had stances on bottle feeding versus breastfeeding, and if you had anything to say about that.
That's a really great question. I don't see a lot of discussion of this in the early part of the 20th century. I think that the presumption was that women would nurse their babies while they could, but often women themselves were unable to, either because they had to go out to work, or they had too many other children, or the woman herself was not in good health. And so, bottle feeding was something that was done. And the idea was less to encourage women, or discourage bottle feeding than to just kind of accept it as an inevitability. And that if people are going to do this anyway, they should make sure that they're sterilizing baby bottles and that they are getting pasteurized milk. Pasteurization was a new thing in the early 20th century. Actually, Chicago was the first city that mandated pasteurized milk. It was the first city in the United States where any milk sold within the city limits had to be pasteurized. There were commercially available infant formulas, just like there is today. Those were around in the late 19th and early 20th century. Some were good, some were bad. So I think part of this was also kind of to, discourage people away from something that might be more of like a quack formula and more towards something that might be more reliable or dependable. So, I guess that's maybe a little bit of a roundabout answer, but I think they sort of, my sense is they accepted the inevitability that women were going to have, there were going to be situations where they were going to have to bottle feed. That's just the way it was. In a lot of households, if there were many children, the person who is feeding the baby is often an older child, right? Because the mother has so many other things she needs to do. And especially, for example, if she's a farm wife, she might have so many other things that she needs to do that, easily an 8-year-old or a 10-year-old would bottle feed the baby, right? And so bottle feeding just went on. It was a large part of life for, probably most families.
Yeah, when we were, this year there was, the big formula shortage, and
Yes.
I was talking with a coworker of mine, and her kids are older than me, and out of the house and that sort of thing. And I was talking to her about, we have an 8-month-old and the struggles to find formula, and she was mentioning that when her kids were younger, they would just give them regular whole milk, cow's milk and that sort of thing. And it made me think. I was like, well, I wonder, being a history person, I wonder when the prevalence of formula came about. And I'm glad you talked about it a little bit here. So yeah. Another question for me. You mentioned the Shepherd-Towner Act, and
Yeah.
the interesting thing that Illinois was one of just a few states that opted out. Do you have any idea why they did that?
Yes. Yes, actually. So there's a strange thing in the early 20th century. There's a pretty big divide between um, the American Medical Association, which was formulated in the 19th century to kind of promote the interests of the medical profession, and then pediatrics, which actually developed on a slightly different track. And so pediatric medicine was always really closely aligned with these kind of grassroots campaigns for the reason that I stated, right? You have to have the cooperation of parents or it's not going to work, right? So pediatrics always had this kind of much stronger sort of public health element, or I want to say a social welfare element, right? It also had a lot to do with individuals, like so the kind of the someone who's really thought of as being one of the founding people of American pediatrics is Abraham Jacobi, who came over here from Germany, and he had very distinct ideas about that medicine was really something that needed to take place in a community, right? And they weren't so hung up on the idea of the interests of doctors and private practice. And so what you have in Illinois is the American Medical Association is headquartered in Illinois. It's in Chicago. It still is, right? And so this leading national organization that is promoting the interests of medical doctors saw actually a lot of threat from the Shepherd-Towner Act, because the way they saw it, here's the federal government giving money to campaigns that were not led or controlled by doctors. They were, these various kinds of activities that we've been talking about were done by grassroots people. They were done by club women. They were done by home bureaus. And, these weren't medical doctors. And so medical doctors really said, wait a minute, I don't like the idea of the federal government actually giving money to people who aren't medical doctors. And so because the AMA was pretty politically powerful in Illinois, they were actually able to get the state of Illinois to not go along with this. And it caused a pretty big rift between pediatricians and non-pediatricians in the medical profession.
Well, thanks for that, Lynn. Let's see. I'm not seeing too many other questions coming in. Just one last one, Lynn. I always like to ask presenters. I noticed with all the images you had links. Where you got them. Just if folks out there are interested in learning more, do you have any recommendations for resources, repositories, or books, or websites, etc., to kind of check out?
There's really wonderful digital images that are available if you're interested in looking at them. So some really great sites are the Chicago Museum of History, used to be the Chicago Historical Society. They have a very extensive digital collection. The National Library of Medicine has a very extensive digital collection, as does the Library of Congress. Then some of these smaller organizations like the Infant Welfare Society of Chicago, the Visiting Nurses Association of Chicago, they have, really nice digitally available collections. So you can look at a lot of this stuff. There are some great books on specifically on this topic, on these kinds of child health campaigns. I could, if you wanted to, I could do, it was just not something I did before this presentation, but I could do up a bibliography and send it to you, Pat, if you wanted to post it on the Facebook page. That I'd be happy to do that.
Sure. Yeah. That would be great. And I can also turn that into a document and then link it to these videos as well. And folks can reach out if they have, an interest in getting that list. So
Absolutely.
That would be great. Okay. All right. Well, with that, it's about 8:15 here. So I don't want to take up too much more of each one of your evenings here, but really appreciate, Lynne, you joining us for this presentation this evening. I've learned a whole lot, with somebody who has a young one right now. It's really interesting to see that, everything has a history, as you're well aware, and to learn more about it is very eye-opening and makes me want to learn more, as well. So thank you for that. And
wonderful.
And Janie, thank you so much for joining us tonight as well.
Thank you, Janie.
Providing ASL interpretation, and thank you to everyone who's tuned in and out throughout the course of the evening. Really appreciate that. Hope you all can join us for maybe some more virtual programs, as well as also some in-person programming at the Museum of the Grand Prairie and with the Champaign County Forest Preserve District. So with that, and for Lynne, for Janie, we're going to call it a night. So until next time, thank you all so much.
Thanks, everybody. Thank you.